Back now recognize gentleman from California, Dr. Ruiz.
Thank you, Mr. Chairman. I represent a very rural district in Southern California, and I'm an emergency physician by background. So I have seen the real need for investments and improvements in rural healthcare systems. Patients experience unique barriers to care in rural communities, like long distances to the nearest clinic and transportation challenges, long ambulance wait times that delay critical care, and provider shortages. That's why continued investments in workforce pipelines and programs to improve patients' access to care and quality of care are so important. The committee is considering a bipartisan bill today that would reauthorize several programs that help strengthen healthcare in rural communities. H.R. 2493, the Improving Care in Rural America Reauthorization Act of 2025 by Representatives Carter and Schreier, that I support. The bill would reauthorize three important programs: the Rural Health Care Services Outreach Program, the Rural Health Network Development Planning Program, and the Small Healthcare Provider Quality Improvement Program. Mr. Morris, in what ways have you seen these programs lead to improved access to care in rural communities, and how does HRSA measure the impacts of these grants?
Thank you for the question. The programs, let me speak to the outcomes first. I noted earlier that we have three primary ways that we measure the impact they're having on our community. The first is we look at whether they're improving health status. And so our most recent cohort, which is around 90% of the grantees, were able to show improved health status for the folks they served. The second way is these are essentially
better health.
What's that?
So better health.
Yeah, better health. So they also, these are startup funds. They tend to be a 4-year grant. In the case of the planning grants, it's a 1-year grant. So they're not grants that somebody gets in perpetuity, but they're just to get a good idea off the ground. So one of the things we look at is sustainability, and typically a little more than 90% of our grantees are able to keep the project going after the grant ends. And then
so they add new healthcare services.
Yeah, so we got it, the federal funding got it started, but the community kept it going. And one of the ways that we do that is we don't fund a single entity, we fund a consortium of folks. So a health department coming together with a hospital or a clinic. And we find if you have more people involved in the program, they feel more vested.
So more access to care because there's more services and there's better health outcomes. What aspects of rural health do you see the greatest need for improvement?
Well, I think it's you look at the 5 leading causes of death, and in every state in the country, you see people in rural areas are dying tend to die at a higher rate for avoidable or excess death. So cardiac disease, diabetes, injury, pulmonary disease, diabetes, all of those are high need areas.
Would access to a hospital nearby affect health outcomes in rural communities?
Definitely. I mean, a hospital can often...
So if a hospital would close, it would put in jeopardy the health outcomes of that community.
I think any healthcare entity closes in a community, you have risk.
Well, the big ugly bill is projected to close about 20% of rural hospitals. That's a big problem that's going to take us backwards in improving the health. Also vital to the improvement of healthcare quality and access in rural communities are programs to support the physician workforce pipeline. Title VII of the Public Health Service Act promotes education and training for healthcare professionals. Title VII programs help bolster our healthcare workforce, and we must ensure these programs continue to have the resources needed to help our communities. According to HRSA's own data, our health system is projected to be short by at least 187,000 physicians by 2037. As we face increased provider shortages, I'm concerned about recent actions that not only make it harder for those who want to pursue medical education. The Republicans' big ugly bill capped federal student loans for professional schools at $200,000, which is far below the average cost of attending medical school, and completely eliminated the Graduate Plus loan program that helped them fill the gap between their loans and the cost of medical school. So this will be particularly devastating for economically disadvantaged students from underserved communities, exactly where we need the physicians the most. As we know, physicians are more likely to practice medicine where they grow up, and we need more providers in underserved communities. To make matters worse, the Trump administration has proposed cutting numerous workforce development programs from Title VII. Dr. Chen, what impact would cutting these programs have on the healthcare workforce?
Well, as I've mentioned, our programs definitely have had positive impacts on all of the things that you're talking about, and we recognize that funding decisions have impact.
So eliminating them would have negative impacts. It's okay to say yes.
Well, yes.
Okay, thank you. I yield back.
Gentlemen,